So ironically, this is take 2 of this video because I forgot to press record. And yes, we're talking about brain fog in the menopause, which can be anything from a momentary lapse like I just had to a completely debilitating symptom where women feel like they need to give up their jobs, give up driving, and lose their confidence altogether. If you can relate, stick around because I'm going to give you some surprising factors that might be underpinning your brain fog, as well as 4 tips for improving memory and cognition in the menopause. Hi, I'm Chelsea Green, holistic hormone specialist, and I help women transition from peri to postmenopause naturally using homeopathy, herbs, nutrition, and lifestyle measures. So brain fog, fuzzy head, concentration issues, senior moments, they can all make us feel like we're losing it and wondering if we've got early onset dementia. But there is good news. Whilst it is completely normal to have some senior moments during the menopause years, things will get better. Once we go through menopause and we reach those postmenopausal years, cognitive strength will go back to what it was in the pre-menopause years. So hit the like button if that sounds like good news to you. I think it's important to recognize that it is temporary, that we're going through a transition and things will get better. And from that place, we can have a lot more compassion for ourselves. Just knowing that it's temporary can do a lot for our entire menopausal experience and particularly brain fog. Because worrying, being stressed, getting anxious about being forgetful will only make you more forgetful. So there's my first tip for treating brain fog. Try to show yourself some compassion and have a laugh about it because laughing is great for your brain health. So why do we get brain fog? Well, we know that we have estrogen receptors all over the body, including in the brain. So declining hormones affect brain health and brain energy, all of which can lead to memory issues, focus and concentration problems. And from a holistic perspective, we're going from the outer to the inner, where our focus needs to be much more on our inner needs and desires. So the brain is essentially rewiring. We are shifting from a left brain, logical, linear way of thinking to a right-sided, much more creative, much more intuitive, much more feeling-based way of being. And the more that we can soften into that, then the easier the transition will be. However, there is a lot of talk about menopause and Alzheimer's risk. And it's important to understand that being a woman and going through menopause is a risk factor for Alzheimer's. It's not a causation. It's not a given that you're going to get Alzheimer's. It's a risk factor. And Dr. Mosconi, who's an expert in this field, talks about menopause being a trigger for the other underlying factors such as inflammation and insulin resistance. So if you are interested in Alzheimer's and the risk with menopause, do check out Dr. Mosconi's work. And going back to being compassionate for ourselves and the transition that we're going through, menopause offers us a unique opportunity in which we can get all of our health ducks in a row. Menopause is a time when health conditions, our long-term health, things that might become problematic for us can be highlighted. If we slow down and stop and allow the body to go through the transition naturally, then these things can come to the fore. We can get stuff in order to ensure better long-term health. And if we look at chronic long-term health conditions like cardiovascular disease, stroke, diabetes, metabolic syndrome, even cancers, underpinning those things are those menopausal triggers, inflammation and insulin resistance. So rather than just thinking that it's the menopause and that it's lower estrogen levels that makes us susceptible to these diseases, we need to think about it more holistically. Okay, so brain fog, what will make it worse? Probably no surprise to you, stress will make your brain fog a lot worse. When we go through menopause, we naturally have higher levels of cortisol. And when we are busy all the time, running around doing all the things, giving all of ourselves away to other people and not tending to our own self-care, then we have even higher levels of stress. And from that place, the brain can't cope. It's like there's just not enough bandwidth to deal with all the demands that you're putting on your body. So instead, what we need to do is learn to delegate, learn to say no, only take on those things that fill us with joy, and prioritize that daily self-care. The other biggie for brain fog is blood sugar balance. If you are familiar with the work of Dr. David Perlmutter, you'll know that he refers to Alzheimer's as diabetes type 3. So we know that sugar, gluten, and many other grains dampen down the brain. They cause inflammation in the brain. But more specifically to menopause, we are in a low estrogen state where we don't get the message of insulin. So we're much more susceptible to these kinds of foods. So much so that some women end up in a pre pre-diabetic state in the menopause. So without a shadow of a doubt, we need to be eating to balance our blood sugar levels. Not only will eating to balance your blood sugar levels ensure a better menopause transition, ensure better brain fog and less symptoms all around, but it'll set you up for better long-term health. So we want to be removing sugar and refined carbohydrates and processed foods from our diet. And if you're super sensitive like I am, possibly you need to remove grains altogether. And instead, we want to be eating lots of protein, a fiber-rich diet with lots and lots of plants, lots of vegetables, and healthy fats. In fact, blood sugar balance is so important to menopause, I'm thinking of doing a mini series on it. So if that's of interest to you, pop in the comments below blood sugar so I know to get on with that. And if you don't even have a clue about what I'm talking about or where to start, check out the notes below this video. I have a free download called Thriving in the Menopause, and that will get you started. So another thing that could be the cause of your brain fog is sleep issues. We know that if we don't sleep well, we don't function well, become much more reactive to stress. And from that place, our brains don't function well. The problem is when we are not sleeping well and we're more reactive to stress, that then creates issues with our sleep hormone and we end up in a vicious circle. So if you're not sleeping well, check out the video I did on sleep. I will link it above and I'll put it in the notes below, because beyond balancing your blood sugar levels and managing your stress, I would say prioritizing sleep is the best tool that you have for your menopause and for your long-term health. And in the video I talk about autophagy. Autophagy is like a cleaning up, a sweeping up of all the old debris, the rubbish and the general junk that we don't need. And it happens in the brain between 10 p.m. and midnight when we're asleep. So ideally we want to be asleep for 10 p.m. in order to have the best brain health. Okay, so now I've got two things for you which you might be surprised to learn could be underpinning your brain fog, and the first of those is iron deficient anemia. If you're struggling with heavy flooding periods, or if you have a history of iron deficient anemia and you're struggling with brain fog, it may be worth getting your iron levels checked. The brain requires optimized levels of iron-rich blood in order to function well. And if you're struggling with iron deficient anemia, that could be underpinning your brain fog. So definitely worth getting checked out. And the second thing that could be underpinning your brain fog is a B12 deficiency. B12 is an essential brain nutrient that we typically become deficient in as we age. Symptoms of a deficiency would include fatigue, anxiety, brain fog, numbness and tingling in the hands and feet. So I would recommend anyone over the age of 50 getting their B12 checked annually. And for vegans and vegetarians, supplementation, regardless of age, is absolutely essential, as you can only get B12 from animal products. So start with managing your stress, balancing your blood sugar level, prioritizing sleep, if necessary, getting B12 and iron deficient anemia checked. And then you can use these tips for added benefit. So the first tip is to make sure you are eating enough fat. The brain requires a lot of fat in order to function well, as to do the neurons and the nervous system, so getting the messages from the brain around the body. So there are two types of fatty acids that I like for brain health. The first is omega-3 fatty acid from fish, so fish oils, oily fish. Research shows that those with the highest omega-3 index have the biggest brains and the biggest area of memory within the brain. That's the hippocampus. And people with the lowest omega-3 index have the smallest, almost shrunken brains and the smallest area of memory within the brain. Brain is about 60% fat, and over half of that comes from DHA, so that's why I like the oily fish. But for vegans and vegetarians, you could look at flax seeds instead. The other fat that I like for brain health is MCT oil. MCT oil reduces brain inflammation, and it actually blocks a receptor in the brain that causes memory loss. One thing I've been trying and I've found really successful is drinking medicinal mushroom coffee with MCT oil and collagen powder. The mushroom coffee that I'm using contains lion's mane and reishi, both of which are neuroprotective. I originally added the collagen powder for joint and skin health, but there is some research that suggests that it is cognitive protective and will help with cognition and memory as well. So I take the mushroom coffee, the collagen powder, and a teaspoon of MCT oil and whiz it up in the NutriBullet. Not only does it make a really nice coffee, but I can definitely say I've noticed a difference in terms of mental sharpness. Okay, so the next tip is choline. Choline is an essential nutrient and it's the precursor to the neurotransmitter acetylcholine, which supports memory, cognition, and brain health. Acetylcholine protects against age-related memory issues, especially those related to Alzheimer's and dementia. So it's really important to have a choline-rich diet to help with the synthesis of acetylcholine. But just like with B12, we become not as good as we age at making it ourselves, and we often become deficient in it. So we want to ensure that we're eating lots of choline-rich foods, which includes salmon and eggs. And again, like with B12, we get it mostly from animal products. So our vegan and vegetarian friends, it is one you would probably have to supplement. Okay, so the next top tip is strength training. Any type of movement is good for the brain, but research and studies have found that strength training is the best type of exercise for brain health. And that's because it helps with both blood sugar balance, and because having greater muscle mass, i.e. less body fat, has a direct impact on cognitive health, memory and focus, and it prevents against dementia and Alzheimer's. And of course, the beauty of strength training is that it's the perfect exercise for menopause. So ladies, start lifting those weights. It's great for your menopausal experience and it's great for your brain health. Okay, the final tip is to hydrate. Don't underestimate how important water is to your brain health. Your brain is 80% water and it actually can't store water. So as little as a 2% water loss can result in fuzzy thinking, memory issues, focus and concentration issues as well. Every single function in your brain requires water. So being hydrated is the best thing that you can do for your memory. Being dehydrated literally shrinks your brain. I cannot emphasize this enough. We need to be hydrating probably a lot more than most of us are doing. You and me both. So there we have it. In order to have better brain health, better memory, better concentration, better focus, we need to be reducing stress, balancing our blood sugar levels, and prioritizing sleep. Then we want to rule out any underlying factors such as iron deficient anemia or a B12 deficiency. And then we can add in all of those extra tips. Make sure we're getting enough fat in the diet, enough water in the diet, enough choline-rich foods in the diet, and make sure you're moving your body, doing that strength training that will take you far in menopause. So thanks for sticking around. If you found this helpful, make sure to hit the subscribe button. And if you're struggling with sleep, check out this video next.